across the country have seen more and more cases of the mumps, and that disease spreads in places with close contact. So someone in your household, if they have it, it could spread easily. Joining us now to talk about the recent mumps outbreak is Dr. Bhide. So you were just telling me, especially college campuses,
Sure.
you know, you think the dorm rooms there.
Exactly.
If one person has it, probably the whole dormitory is going to get it.
Right.
Talk about how easy that spread is.
Well, it is very contagious. It's caused by the mumps virus, and so like other viruses, it's easily spread between people. It actually causes fever and joint aches, muscle aches, the things that we see in other viruses, and of course just feeling poorly. Now, the unique thing about this particular virus is it likes the cells of the salivary gland, so what makes saliva, which is a gland called the parotid gland right here in front of the ear and below the ear. And so that can get very, very swollen, and that's when people are especially infectious. And it's actually spread by respiratory droplets. So when people cough or sneeze, those droplets are in the environment. They can be on solid surfaces.
Speaking of, sorry.
Right, and when you touch them and touch your nose, that's really how it spreads. So of course on college campuses, daycares, schools where people are close to each other, it's very contagious.
Well, I think we have a photo too, Justin, if you can pop that up, of, because you were saying it kind of swells up.
Right, right. So
what you would see here, so that's it there if you see that.
Yeah,
so that's actually what the mumps looks like.
Right, that's the actual virus. And then it causes swelling of the gland you can see right in front of the ear and below the ear. And it starts sort of at the top and then it goes lower with the swelling. And there can be so much swelling that actually you can't even see the jawline.
Oh, wow. So I was going to say, you can definitely feel it then.
Yes. Oh, yeah. And it's very painful and a lot of swelling. It does resolve on its own, fortunately, so the vast majority of people do recover. The other concern that we have is in males, it can actually cause inflammation of one of the testicles.
Oh, wow.
We call that orchitis. So, of course, that's very painful and causes a lot of swelling. Fortunately, again, most people do recover, but it's just something that you don't want to get. So,
what age group is, I mean, is it just really anybody, or
it can be anybody, but what we're really seeing is people under the age of 17, and then of course the college age kids. And we're seeing it in people who have had the vaccine, so most people get 2 vaccines. But the people who are really susceptible are people who have never been vaccinated. So they're 10 times as susceptible to get this virus. So really our best measure to prevent getting this infection is to be vaccinated. And so even if you, as a child, have not been vaccinated, it's not too late to be vaccinated, and you want to make sure that you have both vaccines, both doses of the measles, mumps, rubella vaccine.
And that's one of the basic vaccinations, right? For school-aged kids, as well as, I think when I went to UNF, I think they made me show documentation.
Exactly.
So the only reason why is if parents just didn't want to get their kids vaccinated?
Right. Most kids will get it between 12 and 15 months, and then again before kindergarten.
Okay.
And really the only people who shouldn't get that vaccine are people who are, say, immunocompromised or who have had a reaction, you know, difficulty breathing or swelling of the lips with that vaccine. But the vast majority of people should get the vaccine. It's your best bet because, again, we don't have antiviral treatment. We don't have a cure for
really
this
nothing
virus.
to do if you have it, is what it
and
sounds
it's just,
like.
I mean, people just really suffer. So you really don't want to get, you don't want your child to get this.
Well, if somebody has it, and obviously there's nothing you can do, but how long do you need to stay away from people? I mean, you don't want to spread it if you get it. So what do you do at that point?
Well, one of the problems is that they can spread the infection even before they have symptoms. And so a lot of people, and then up to a third of patients don't have any symptoms, and they can still spread the virus. But once they have that swelling of the salivary gland, the parotid gland, they're infectious for 5 days afterwards. So those people should stay indoors, isolate themselves so they don't spread it to other people. And now we're in the holiday season, we're around people, it's cold, we're indoors, and so hand washing is very important, especially when you're around a lot of people.
Definitely.
Try to avoid touching your nose and your mouth, and then just stay away from sick people, especially people who are coughing and sneezing.
I know, and I don't know why doing this interviews made me just want to cough just talking about it. I'm not even sick. I'm just like, oh gosh, sickness. Thank you so much for coming on and filling us in. If you want to learn more, we will post this information on our website, newsforjax.com.